We actually got a quote for $800,000,
The reason we can't go into certain markets is because of the cost.
and we're building this for a 4 to 5 figure amount.
Welcome, everybody, to another episode of AI with Bry, where we explore how leaders can learn, leverage, and lead in the age of artificial intelligence. I'm your host, Brian Denstead, and each week we sit down with builders and leaders who are trying to use technology thoughtfully to solve real human problems. Today, I'm joined by Sheila Pande. She is the CEO of Tandem, and Sheila is leading one of the most important conversations in healthcare right now: how we support maternal mental health through trust, community, and culturally responsive care. Tandem sits at the intersection of human connection and modern technology, and Sheila is bringing a very grounded, system level view of how AI and digital tools can responsibly scale and support without losing empathy or equity. So, welcome to the show, Sheila. Thanks for being here.
Thank you. I'm excited to be here.
Well, our first segment up is the learn segment. So, Sheila, you are leading in a space where trust, lived experiences, and outcomes matter so deeply, and AI is becoming present in every headline we see. What have you learned recently that's really reshaping how you think about its role?
Yeah, well, as we know, AI is built on what we have evidence for, and we don't have evidence for everything. We don't have large data sets for everything, and we don't have large data sets for a lot of women's health conditions or conditions that only afflict women, and we don't have strong data sets that necessarily reflect the diversity within diversity.
Hmm.
And I think that's just when we think about the history of science and the history of healthcare, it's actually a really short history. It's maybe been 100 years. And the really large standardized data sets, the golden rules and the golden standards for healthcare, honestly, I think it's been maybe 50 years since those standards were established. So I think, when we're learning about AI, we have to take history into context to understand the quality of the suggestions or the decisions that it's making. And I have felt that the larger AI tools like Anthropic, ChatGPT, they were trained well in understanding where there might be gaps in data, but they're not the models or whatever is being output, they're not necessarily saying this is where we need data. They're just reiterating the headlines that we know that exist. They're not coming up with solutions to fix that data, which is why we still need researchers, companies, and R&D.
Yeah, I mean, you nailed it because like the AI systems have already devoured every piece of information that's connected to the internet and they're craving so much more. So I think it's thought leaders like you that are going to go out there and create new data sets to give to the AI to help, I hope, really push in and remove bias. I mean, because there's so much bias in it. Like, not only is the AI like trying to please you and make you happy, like if you ask it a leading question, it's going to say, "Of course, whatever you asked is right," and and
Yeah.
stuff like that. But if you ask it the opposing viewpoint, it'll say, "Yes, of course, that's the right." You know what I mean? So it's always like trying to please you, but I inherently notice the bias just because I'm in the plant-based side of things. Everywhere
Mm,
I look, the plant-based bias comes through. And especially in what you're doing, I'm sure you've seen the bias in some of the questions you've asked it because the data just isn't there yet to support some of the stuff that you're trying to do.
yeah, I would say, I mean, like from a product standpoint, I already know that the data doesn't exist in the formats that we need it to exist, or the depth or the quantity. Uh, but where I really see bias is when I am communicating with AI about my like investment strategy or my financing strategy, because both Claude and ChatGPT know I'm a woman. I'm not sure when they figured that out, but I can tell that they are producing answers as if I was a woman. And I have time and time again said, to be frank, I've said, I actually want you to phrase this as if I was a white male.
Yeah.
And it significantly changes the tone of voice,
Yeah.
the perspective with which you pitch something. And I think that that just goes to show the biases, and unfortunately, potentially who it was trained by.
Yeah.
So, but I think the learning part of this is, um, at the end of the day, it's learning context prompting and understanding. Unfortunately, you have to understand the larger context of how it's producing the answer. And I think that's why a lot of people are afraid of AI, because they receive an answer and they're like, well, that's really dumbed down, or that doesn't have to do with, it's not, considering this, this, and this. And I'm like, well, you didn't tell it to. So if you don't tell it to, it doesn't know who you are. It's still just a computer. Actually, it's not the person sitting next to you. And so I think what has become evident to me, and the speed at which learning has to happen. So, as you know, I'm learning how to essentially vibe code, but I actually didn't have, this is new territory for me. I have no baseline coding experience really. And when I am thinking about vibe coding or participating in vibe coding, I realize that I have to do a little bit more searching on the side, either in ChatGPT or Claude, separate from the terminal, so that I have a full understanding of why the terminal is making those decisions. And I think
Hmm.
if you had told me that maybe 2 years ago when all of this started, I wouldn't have understood why I needed to do that. And now I have the confidence to say it's okay that I don't know whatever the context around like a node.js script, but I can ask Claude over here so I know what terminal is doing.
Yeah, absolutely. And I think you're a perfect example of what I've seen is just somebody diving head first. Like you have no real programming background, maybe a class back in high school or something that we all had to take. So, like you're the perfect example for this learn segment here. I mean, I guess, talk to us about just some of the stuff you've learned in just the past couple months about how I don't know. I'm just so proud of you because you're unabashedly not afraid to just dive into the deep end and say you're vibe coding your platform, and it is coming to life right before both of our eyes.
Yeah, and we're vibe coding a very complex platform, and I honestly didn't realize how complicated it was until I started vibe coding, even though I had all of the components mapped out.
Hmm.
And um, I think like I'm not sure necessarily that it's like confidence that's driving me. It's definitely not confidence, but it's that I can't mess up,
Hmm.
because you can undo what you're doing. But I think one of the cooler things that I saw was, I think the first day, I'm not sure if I was on the call with you when that happened, but I started Sprint Zero, which is essentially just setting up, um, like GitHub and AWS and doing all the DevOps. And when I saw the amount of agents that Claude Code spun up just to get this done, I realized, oh my God, there would have been 6 people working on this in a dev shop. And that's why these dev shops were providing us the quotes that they were providing us, because not only are that many agents working like in Sprint Zero, they're going to be working through Sprint 8.
Yeah.
And um, and I think what's interesting is that I have worked with dev shops before, but you, on the client side, you don't really see what's happening on the back end and how work is divvied up. And
Hmm.
if you ask Claude, you can see what's happening and it will tell you. And I think having that insight is really helpful as a business owner, because then you're like, okay, I would potentially have these people in house, or like what will their role be in house once we have them in house, because they will be managing agents who most likely who will be doing a DevOps role. So yeah, I think it's number one, seeing the agents that Claude has been spinning up. I didn't know that so many people were necessary to get one sprint done or one AWS task done. And then obviously, like, the speed at which it's happening is like absolutely insane. And I think I told you this too. It's at the second sprint two. I had provided Figma files, but the whenever the UI came together for that side of the platform, the UI that it created like never existed. And so it just knew what the workflow, what the screens needed to exist for that workflow.
Yeah, it's so powerful. I mean, I want to jump into the leverage segment because you've really started to touch on it a little bit. But I run into developers and business people and things like this all the time and have this conversation. How much will vibe coding or agentic coding increase my development speed? And it's that question of like, you are living proof in my mind of exactly that speed that I don't think the world is fully aware of right now on any level. I mean, I like to say it's safe to say it's at least double the speed, but I would say at, if you've got it planned out as well as you do, it's potentially 20 or 30x the speed. What do you think? How do you answer that question for people that might be concerned that it's not going to do that? Obviously, your mileage is going to vary depending on your code base. You're getting to build something brand new. You don't have any legacy code like some other people would, but the speed at which you're going right now and the money that you're not spending, those two things are very, very real for entrepreneurs.
So as you know, the original quotes with dev shops that we got were anywhere between 3 and 6 months, with a traditional dev shop. And now that I actually see the complexity of the software, I'm going to say it would have taken 6 months. Um, I think you and I have come to a conclusion we will be done in 6 weeks total, which is
That's right.
crazy. So what I tell people now is, you know, I think I haven't found like the right quote, like, we're saving, actually, I do say we're saving 98%, because I know what the end cost and the cost of the end result will be versus a dev shop. So we
Mhm.
are saving 98%, but I think like I think people are when I say we're going to finish by the end of the year and that it will only have taken 6 weeks, that seems to be more impressive. Like the compression of time than the 98%, because 98% could maybe my MVP would have only cost. People don't know. They're like, oh, it would have cost $30,000, and now you're spending $1,000. And I tell people, no, we actually got a quote for $800,000, and we're building this for a 4 to 5 figure amount. And for some reason, that's not impressing people.
Mhm.
The compression of time is impressing people. And I think for people who have been along the ride of uh, this building and this journey, especially my early stage investors, I think they're going to be shocked when they see the quality of the program, because we're building a program for a minimum of 8 different user permissions just for an MVP, because we know that that's what is required for the client. And so I think um, what also has been cool is saying, okay, for those 6 months, like our MVP build budget was about $30,000 a month, $30,000 to $50,000 a month now. And that was only for this end result that we're going to have done in 6 weeks. So now also our development timelines are compressed. However, I think you and I have discussed this. We still need strong evidence from clients to invest in that.
Hmm.
Because I want to build something in generative AI doesn't mean, and maybe it only costs $5,000, it doesn't mean that it is the next thing that we should invest in until we see if we're actually meeting our clients' needs with the MVP.
Absolutely. And I want to talk more about the leverage that you're seeing and go down that rabbit hole a little bit more. But I think it's going to be important for you to set the stage and give a little bit more context of what exactly is Tandem? What are you trying to build? You've been on this mission for over years now. Honestly, you've crafted so much documentation of exactly what it is you want to bring to life. Help lay it out for people so they understand it as we go down the rabbit hole a little bit more with the AI pieces.
Yeah, so my goal with Tandem has always been to reduce racial disparities in mental health outcomes. I It's always been an issue. I have my master's in public health. I also have a background in liberal arts. So my passion has always been to provide solutions and provide cost-effective solutions that actually integrate into health systems so that people will utilize it. And when I started looking at the market, I really just realized that solutions were reliant on the mental health workforce, and the mental health workforce can only meet 25% of demand, unfortunately. And that is a separate problem that absolutely needs fixing, which I cannot fix alone. I will need to, like, I don't know, go to the Senate or become a member of Congress. Um,
Right.
I can't fix that right now. And so um, I when I started looking at business models that health insurers were innovating in, that's when I decided to, like, keep my pulse on digital health because, you know, I am a systems thinker. I am a thoughtful go to market strategist, and I just really wanted to make sure that we weren't going to enter the market as one business model and then have to switch over to something else. I think there's a lot of change operations that can mess up an early stage company, and it doesn't going direct to consumer doesn't provide the financial solutions that are necessary to reduce racial disparities. So finally, the way that I have built my company is when I found a business model that aligned with my mission, that's when I decided it's time to go to market. However, building out a software to meet the needs of that business model, which is a B2B to C SaaS solution. So we integrate on health system side or clinic side to screen, onboard, and monitor patients. And our first patients are maternal mental health people, and then those patients have access to our patient facing app, and it is all covered by insurance as long as your primary care or OBGYN clinician monitors you.
Hmm.
So this solves a lot of problems. It's covered by insurance, it's covered by some Medicaid, which should allow access to racially diverse groups, and it's accessible and doesn't rely on the mental health workforce. So most people have mild to moderate symptoms, and we will also be able to just create a lot more tools for not just patients, but also for providers, and ensuring that they feel comfortable providing access to patients. So it's very complex. As you know, our MVP has to meet the needs of 8 different user types. And that's not because I want to build a complex product. That is the minimum expectation of a clinic. They don't have time. Their focus is not like, where do I click next, or can I call Sheila for customer service help. Their focus is on getting a patient taken care of safely and moving on to the next patient. So even in an MVP environment, even though it's my MVP, it is not their MVP.
That's right. That's
Yeah.
right. I think that's so well said, and it's definitely a large area of the space that you need to get into. I have a little one running around here, and I know how important that is to all the moms out there for exactly what you're working on accomplishing. So, um, just to try and put a pin in the leverage section here, like we've gone down the programming rabbit hole, but how else are you leveraging AI with your team and in the building of Tandem? Give us a few more anecdotes as we move into the leadership segment.
Yeah, well, as an early stage company, there's a lot to do and there's just a lot of expectations to perform. I'm just like, who am I performing for? And I realize I have to perform for myself. What are the most minimum things that I need to do to build trust with those first 10 or 20 clients? And we're using AI to build out agentic solutions on the B2B marketing side. We have things mapped out on the sales side as well. And I don't think that in healthcare sales, humans will be fully replaced. I think the human connection will remain important. However, the prospecting and the trust building through marketing will be much more streamlined and honestly AI driven. So we have a B2B marketing agentic stack, and that to me is important in order to continue building trust with prospective clients, to develop content so they understand how this product can support their patients.
I love it. I love it. There's so many different ways I see you're using AI. You're using it in every department of the business that you're building it. So geek out with Sheila more in person if you want to unpack her tips and tricks. I'll make sure we put your links in the show notes here for people to connect with you. As we wrap the episode up to a degree with the leadership segment, you're leading through so much complexity, equity considerations, rapid tech changes. What do you feel like leadership looks like in this moment?
Yeah, that's such a good question. I think so. What I have really had to do, and I think I might have done this on a call with you, but I said I have really just had to use AI to understand AI. And I said, like, how are you built? If I want to um, have a proprietary data set that makes decisions to improve health outcomes, like, what are the AI knowledge bases essentially that are necessary? And so I honestly think the best leaders right now are honest and vulnerable with what they do and don't understand, and recognize that, okay, if you want to achieve something, like, your understanding of how to achieve that might be a very untraditional hiring model than what we're really used to. So, in my case, it's not that we need someone to build an LLM. We need to hire people to understand where to get the data sets and then how to construct the knowledge base. This is like not a job that I thought existed last year. And obviously the big tech companies have had those jobs, but now smaller companies will be required to have those types of jobs. So I think leadership in this space is really just being frank with yourself that you don't understand,
Hmm.
and that you have to ask questions, and that your org structure in order to achieve something with AI is going to look much different than what you might have thought it would look like. And so you have to move quickly.
I agree. I think the more I go down the agentic development framework
Yeah.
that I want you to start embracing soon is really around programmers are going to have to change jobs. But like we've listed out at least 10 different new jobs that those programmers can do. I mean, like the factory workers on the floor building the cars or whatever were replaced by the robots, right? And I see developers in a big way having to move towards fixing the robots on the assembly line floor in some fashion. You know what I mean? So yeah, I mean, but let's take it into this leadership mindset, like healthcare executives, nonprofit leaders, all these people in this space, they may or may not be embracing AI. What do those leaders need to do to shift things in their minds, in your opinion?
I mean, I think my first conversation with a leader who feels intimidated or timid, I would, I have actually asked someone this. I'm like, what is a project that you've just ignored? Like, why, and why did you ignore it? And they're like, well, it costs $50,000. Or like, I just don't have the time to hire someone, or I literally don't understand it. And I think that's a great place to start. And like, is that project going to like help improve whatever outcome you seek, and should you be spending time on it? That's how I came to the solution of we need to build like B2B agentic marketing. And I think, as you said, like our next set of agentic solutions will be on the programming side. And, why is it that we need both of those things? We need both of those things because they are critical infrastructure to servicing our clients like right away. And we're fortunate that we don't have like historical code, or legacy code or legacy hires. And we will, I think the hardest part about this will actually be finding the people to help us manage these agents. It's a new job. It literally doesn't exist. Like I haven't seen a job posting for it, but I will tell you that my forecast has like every like department has like a lead of agentic solutions for that department. That will
Mhm.
be a high six-figure paying job in the next 18 months.
I I agree completely. Everybody's got to reevaluate and look for the agentic herder or the agentic manager, whatever titles that are going to come out. So I'm not worried about the developers going away because there's going to be 50 new job titles that open up as that happens.
Yeah.
I'm curious, like you're taking your approach is very driven on the ethical lines around certain pieces, like to bring diversity to healthcare in a big way. What ethical lines should leaders really be very clear about, especially when it ties to healthcare?
Yeah. I mean, I think that most healthcare organizations at this point in time have some level of like social determinants of health or health equity, like governance, if you will. But now, well, it might not be governance, it might be policy, and it needs to move into governance.
Hmm.
Because if you're like sort of internal policy is like to consider equity, like you can't tell the AI every time to consider equity. You need to have a governance plan to embed that into AI structures. Um,
Hmm.
and it needs to be part of a larger checklist, not just like an afterthought. So I do think, I mean, I have no idea what's happening with the larger players, but I do think younger companies have the flexibility to start embedding that as soon as possible. And I would say that, most digital health companies that are young, they're coming from a mission driven place. Um, they're looking at markets that don't get healthcare. And so it's embedded into their models anyway. I would say that even though I'm saying this, it's not like I have it solidified and like I've done a training with everyone, but it is something that I think about a lot. And how do you start documenting that? And I also think that's what's really cool is even at this point in time, Anthropic and Claude like remembers documentation that I created and I forgot that I did. And, and I'm
That's
like,
right.
oh, I did do that. I did spend 3 hours on that. And so I think again, it's actually powerful to not have legacy code and legacy infrastructure if you really want to start fresh and start training your organization, but also your AI organization to have the health equity aspects.
I think you really anchored it there because the light bulb just went off for me with the cost. If you stick with this 98% slogan, and I think you should, I think it's a great marketing tactic as well. Even, you know, it's always those blurred lines on certain things, but the anchor for me is that if you can save 98% of your costs as you go into this, like the reason we can't go into certain markets is because of the cost.
Yep.
You know what I mean? Like Bill Gates is trying to end malaria worldwide and some of these other things, and it's a cost issue. I just can't get the $2 pill to that one place on the planet because it's too expensive to transport it and deliver it. Like, but the AI is going to drastically drive down the cost to go into certain markets that we were previously untouched because of cost structures. And I think that really just hit me like a ton of bricks as you were saying that. And so the health equity pieces can be unlocked for so many people that it was previously unreachable because of costs.
Absolutely. And I would say even business development has a cost. That's why you have to hire business development teams. And what I'm seeing in the business development space, um, I forgot to tell you this, but I found a guy and he has an AI tool that's for um, both state and federal government contracts, which again is very important for me in order to address racial disparities. We need to be contracted at government levels to reach certain populations. And that's miraculous. Like, I don't need to actually hire 12 business development people to go find government contracts. I need to have a subscription with this guy. It's literally $200 a month. And and then he helps you write it because he has an AI system that helps you write it. And
I
I
love it.
realized what our expenses will be then is us running it by our lawyer to make sure our IP is protected and we align with regulations, and then maybe we'll hire a person to review the federal contract,
Mhm.
but we're bringing down our federal contracting business costs from hundreds of thousands, millions of dollars to $200 a month.
That's crazy. Yeah, the bigger expense is taking the investors out to dinner or something.
Yeah,
So,
yeah.
Sheila, this has been so powerful. Thank you for all the work you're doing in this space and sharing your perspective today. We really appreciate having you on the show.
Thank you. I'm excited to continue learning more about AI with you on AI for Bry.
Tandem's approach, in my mind, really reminds us that technology only matters if it's serving the people with dignity, care, and intention. And I love that that's some of your core mission of what you're trying to do. So thank
Absolutely.
you again, Sheila, for being here.
Thank you.
To all our listeners out there, thank you for joining us today on AI with Bry. If this conversation resonated with you, please follow the show, leave us a review, or share it with someone working at the intersection of health, community, and technology. You can learn more about Tandem at beintandem.co. Did I get that right? All
Yep.
right. And I'll make sure that link is in the show notes for those of you listening to this and not watching it. Connect with Sheila on LinkedIn. And again, I'm Brian. And as always, learn, leverage, and lead.
This episode of AI with Bry was hosted and produced by me, Brian Denstedt. Produced with help from Nancy Velasquez and Kelly Lopez. Video by Leo Moralina. Sound AI generated. Find us on all platforms at AI with Bry and visit ai.bry.net for more. Learn, leverage, lead.